Hi everybody, this is going to be your first lecture of the semester. I'm trying to do screencasts and see how they work for this semester. This will be the only one that we have for the summer, but I'd like to get your opinions on it to see if it's something that we should continue or if it's something that I should expand to the rest of the class. So the screencast allows you to pause and be able to watch this like a movie. You won't be able to click on any of the links, but I can give you instruction and make sure to get you the links if you need to. So the name of the class, Prevention and Treatment of Athletic Injuries, is a mold of both the profession of athletic training and just general sports medicine, which include any profession that practices sports medicine. A large part of sports medicine is athletic training. Like I mentioned in the syllabus, the athletic training portion of this course is very important for students wishing to pursue athletic training specific undergraduate or even graduate degrees. So we do spend a little bit of time specifically talking about the athletic training profession, but I will also try to bring that back to sports medicine in general and physical therapy, nursing, and some other professions as well. There are some classes here like the HES 273 lab, the HES 154 that you can see as well if you're interested in more sports medicine courses. You're also free to contact me if you have any questions about what you should be taking for any entrance into our athletic training education programs around the state, both at Grand Canyon University and NAU, or around the country. I can try to help you out. So we're going to answer some questions during this lecture of what is sports medicine, who works in it, what's an athletic trainer, how do you become one, where are athletic trainers found, what do athletic trainers do, and how are athletic trainers different than personal trainers. So what is athletic training? Athletic training is what I do. I am a certified athletic trainer. It is practiced by athletic trainers who are healthcare professionals who collaborate with physicians to optimize activity and participation of patients and clients. We work in the prevention, diagnosis, emergency acute interventions or evaluations, as well as dealing with chronic medical conditions, including any type of disabilities or rehabilitation. This is the National Athletic Trainers Association definition. You can access the National Athletic Trainers Association through the website nata.org. So if you're interested in any type of athletic training, or if you have any questions specific to athletic training or sports medicine, you can go ahead and go to the nata.org website, and it can answer any of your questions here. There's a lot of great information on here. If you're interested in any other type of professions like physical therapy, the APTA, American Physical Therapists Association, or any medical school, the AMA, physician assistant studies, you can go through even Google search and find the national organization responsible for whatever profession you're interested in. And I highly recommend that you do that. So athletic training is recognized by the American Medical Association as an allied healthcare profession. We'll talk about when that came around here in a minute. It's very important. They do recommend that every high school in America have an athletic trainer available. That's not always the case. As a matter of fact, the majority of high schools in America do not have certified athletic trainers on staff or even covering their athletic events. It's a problem. We see it all the time with any news stories that come out of unfortunately, high school athletes being severely injured or even dying through athletic activity. A lot of times there's not an athletic trainer present. So this recognition by the American Medical Association was very important to our profession. You see a crossword activity on here. This is not worth any points. Don't worry about this crossword activity. I have been unable to get that to work in this module, so don't worry about that. Here's a link here. This will take you to the American Medical Association resources, and the definition of athletic trainer. So you can go ahead and type this PDF into a different browser and be able to see the American Medical Association's definition of athletic training. Again, you can do that with physical therapy, nursing, medical school, physician assistant, whatever you're interested in. So a brief history of athletic training again, not to be too specific to athletic training, but I do need to make sure that we cover some of the information. So in the 1930s is when athletic trainers started to get together and started to realize that there was a need for some type of unity. They got together at these relays called the Drake Relays, and it was unfortunately a failure because they didn't have a good way to exchange their ideas. They didn't know how to communicate very well, and they didn't have any money, which at the time was, and even now is important for making sure that you can create an organization. It wasn't until the 1950s when we started again, and again it happened at a large gathering, and this time we had backing. We had backing from the Kramer Chemical Company. We decided to create national secretary and board of directors and started to become a profession. Again, don't worry about these quiz me's or Diz Do You Know. I'm giving you all the information there. We created a journal of the National Athletic Trainers Association, the NATA, which is very important to help exchange ideas. That's very important in many professions, including physical therapy, which has their own journal, and many other journals. We developed a code of ethics, which again, as a profession, especially a medical profession, having a code of ethics is important. Undergraduate education was formed. At these 4 schools were the first: New Mexico University, Mankato State University in Minnesota, Indiana State, and then Lamar. We started to become recognized in the late 1960s, early 70s by the American Medical Association. It doesn't mean we were recognized as an allied healthcare profession, but just started to be recognized for our role in healthcare. We started certification exams in the 1970s, so there's only been certified athletic trainers for about the last 40 years or so. So it's a very young profession. Graduate education, master's degree education were created at University of Arizona and Indiana State. University of Arizona program has now moved up to the Valley, and it's at A.T. Still University, where I did my master's work. It's out in East Mesa. In 1990 is when we gained full recognition by the American Medical Association. This is very important for our profession. This really gave us legitimacy as athletic trainers. We revised things like our code of ethics, our research studies, really trying to solidify ourselves. Again, very young. Only 1990 is when this was happening, so it's a very young profession. Since 2000, there's been important changes. As of 2004 specifically, you must earn a degree from an accredited athletic training program, whether it's a bachelor's degree or an entry-level master's. Typically the bachelor's is the most common. The Commission on Accreditation of Athletic Training Education, CAATE, C-A-A-T-E, and you can go ahead and Google CAATE for athletic training, is the organization where you can find where all of these athletic training education programs are available. Again, I know the links aren't working here. If you have any questions about these links, you're welcome to send me an email. I'm trying to give you as much information as possible. This was set up and the JavaScript isn't working, so I'm trying the screencast. Hopefully it will work out okay. On the NATA website, you can find the steps to become an athletic trainer. So we have athletic trainers up here, how to get certified, information for students, information for the public, all on their website. You can take a look at that. Okay, as of 2011, there were 344 accredited schools around the country for athletic training. Here are the names of some of the other organizations. If you're interested in physical therapy, there's your organization, Nurses Association. I'll leave this up here. This is the Hippocratic Oath. This is an example of a code of ethics. You can go ahead and pause it. I don't need to read it to you, but it's an example of a code of ethics that physicians take. I'm sure you've heard, above all, do no harm. That's essentially what the physicians are taking. It's called the Hippocratic Oath. So you can go ahead and pause the video here. Take a look at that. I think it's interesting. I think it gives you a little bit of an idea of what ethical standards a profession needs to be based on. There are different points of education, different domains of education that you may deal with in sports medicine, whether it be orthopedic assessment or nutrition, administration, pharmacology. There's a lot that goes into sports medicine as a profession in classes. Some of the specific classes are biologies and anatomies, things you might be taking now, and more specific, therapeutic exercise, rehabilitation, pharmacology. Clinical expertise is required, or clinical experience is required. Know that that is very important when dealing with the healthcare profession. You're going to have to get into the clinic and start hands-on stuff. We have numerous different internship classes on campus and personal training, actually athletic training practicum, that I would highly recommend getting into a healthcare setting. You will in this class, at least for 2 hours, or at least interview a sports medicine professional. So I highly recommend that. It's a great opportunity to gain that experience. So where do you find people practicing sports medicine? Well, everywhere. K through 12 schools are becoming more and more common. High schools are a big part where athletic trainers are found, big place. College and universities. A lot of colleges and universities have multiple athletic trainers on staff, or other people practicing sports medicine, physicians assistants, doctors, physical therapists, etc. We are in professional athletics, but only 1% of athletic trainers work in professional athletics. It's a very small amount. There are goods and bads. You can go to the NATA website and find information on all of these settings. Through here, if you go through the athletic training link, you can find a lot of information about different settings that you can work in sports medicine or athletic training, and get some pros and cons of working in professional athletics. We are found also at working Olympics or X Games, in sports medicine or physical therapy clinics, at hospitals. Performing arts venues is an up-and-coming one. There are athletic trainers that are involved with Cirque du Soleil and other ballet companies or other performing arts companies. The military is a big part of where athletic trainers are found, and again, it's a growing setting where we're maybe civilians working on a base. And then public safety, recreational athletics, working with fire departments, working with police departments, recreational athletics, working with people that are just maybe the weekend warriors out on a Saturday or Sunday. So athletic training is not personal training. Athletic training is a minimum of a bachelor's degree or an entry-level master's degree. We do have on the NATA website, if you click in the athletic training section, we do have some information about what is specific to an athletic trainer, and then athletic trainers versus personal trainers. So you can have a little bit of an idea. I know a lot of you are interested in personal training. It's not specific to athletic training. There's your information about job settings if you're interested, about the different settings. So you can click on that and get some information about the differences between athletic training and personal training. Just know that if you're in the personal training track, that does not allow you to sit for an athletic training exam. You'll need to go and continue on to one of those accredited programs. So again, take a look at that sheet if you're interested in the difference between athletic training and personal training. Athletic training specifically, we have a bachelor's degree at a minimum, if not a master's degree. We do have a comprehensive certification exam. We must continue participate in continuing education, and we must adhere to our standards of professional practice, as opposed to a personal trainer who may or may not have higher education, may or may not be licensed, more than likely not be licensed, may or may not participate in continuing ed. So although personal training is a growing field, it's not as stringent as athletic training. Okay, we are regulated in the state, especially in the state of Arizona. We are licensed. Here are the 4 routes of state regulation. In Arizona, we hold a license, which is the most restrictive. It both protects our patients and protects us as athletic trainers. Each state has their own different type of regulation. Again, here's a map of what states hold what. You can see Arizona in the green, which means we hold a license. Okay, information on other types of regulation. Really just know that Arizona has the license. So let me know what you think.